Common problems men have in bed. What is sexual brokenness in guys? Sexual brokenness is any physical or mental issue that keeps you or your accomplice from getting sexual fulfillment. Male sexual brokenness is a typical medical issue influencing men, all things considered, yet is progressively regular with expanding age. Treatment can frequently help men experiencing sexual brokenness. The principal kinds of male sexual brokenness are erectile brokenness, trouble getting, keeping an erection; untimely discharge, arriving at climax too rapidly; postponed or repressed discharge, arriving at climax too gradually or not in the least; low drive, diminished enthusiasm for sex. What causes sexual brokenness in guys? Physical reasons for by and large sexual brokenness might be low testosterone levels, doctor-prescribed medications, antidepressants, hypertension drug, vein issue, for example, atherosclerosis, solidifying of the supply routes, and hypertension, stroke or nerve harm from diabetes or medical procedure, smoking, liquor abuse and medication misuse. Mental causes may include worry about sexual execution, conjugal or relationship issues, gloom, sentiments of blame, impacts of past sexual injury, business-related pressure and uneasiness. How does sexual brokenness influence men? The most well-known issues men face with sexual brokenness are issues with discharge, getting and keeping an erection, and decreased sexual want. Discharge issue. Issues with discharge are untimely discharge, PE, discharge that happens previously or too early after entrance; hindered or deferred discharge, discharge doesn't occur or takes an exceptionally significant time frame; retrograde discharge, at climax, the discharge is constrained once more into the bladder as opposed to through the finish of the penis. The careful reason for untimely discharge, PE, isn't known. While much of the time PE is because of execution tension during sex, different components might be stress, impermanent discouragement, history of sexual restraint, low fearlessness, absence of correspondence or uncertain clash with accomplice. Studies recommend that the breakdown of serotonin, a characteristic substance that influences state of mind, may assume a job in PE. Certain medications, including a few antidepressants, may influence discharge, as can nerve harm to the back or spinal string. Physical reasons for restrained or postponed discharge may incorporate ceaseless, long-haul medical issues, prescription symptoms, liquor misuse, or medical procedures. The issue can likewise be brought about by mental factors, for example, despondency, uneasiness, stress or relationship issues. Retrograde discharge is generally basic in guys with diabetes who experience the ill effects of diabetic nerve harm. Issues with the nerves in the bladder and the bladder neck power the discharge to stream in reverse. In other men, retrograde discharge might be a reaction of certain drugs, or occur after an activity on the bladder neck or prostate. Erectile brokenness, ED. Erectile brokenness, ED, is the powerlessness to get and keep an erection for sex. ED is very normal, with examines demonstrating that around 1% of American men over age 40 are influenced. Reasons for ED include infections influencing bloodstream, for example, solidifying of the supply routes, nerve issue, stress, relationship clashes, discouragement and execution tension, damage to the penis, incessant disease, for example, diabetes and hypertension, unfortunate propensities like smoking, drinking and excessive liquor, gorging and absence of activity, low charisma, decreased sexual want. Low charisma implies your longing or enthusiasm for sex has diminished. The condition is regularly connected with low degrees of the male hormone testosterone. Testosterone keeps up sex drive, sperm creation, muscle, hair and bone. Low testosterone can influence your body and disposition. Diminished sexual want may likewise be brought about by gloom, nervousness or relationship troubles. Diabetes, hypertension, and certain drugs like antidepressants may likewise add to a low drive.